Welcome to our practice. I'm Dr. Wood. I want to thank you for taking the time to come to our site today and to review this information with me. I just want to extend a warm welcome and just talk to you a little bit about our practice, what makes us different, unique in terms of my background, how we approach illnesses and health and wellness. And so that's what this PowerPoint is to really introduce you to a lot of those things so it makes more sense. It hopefully answers some questions for you. Of course, you can always contact us if you have other questions and whatnot, but hopefully this will give you a pretty good background. So first of all, who are we? Well, Visionary Health is a holistic health practice. I founded it a couple of years ago. We do specialize in a few different key areas, including integrative oncology, tick-borne illnesses, mold-related illness, adrenal exhaustion and hormonal exhaustion, which is really an epidemic nowadays, and also weight loss. We aim to provide very innovative approaches and really world-class information and healthcare solutions to you that really go deep and really get to root issues of why these things are happening. So it's not just about symptoms. And this is for people that are locally, but also for people that are far away. Whether you come to the clinic or whether we work with you remotely, there's different options. But foremost, we want you to know the full story behind what's going on in your life, to really understand what the illnesses or conditions are about, so you can really have your best shot at truly recovering your health and not just treating the symptoms, because too often, especially lifestyle illnesses or chronic illness, is really just being managed and treated from a symptom standpoint, and it's not resolving the issue. So a little bit about me. I'm trained as a naturopathic physician. There is a section on our site you might have seen already about naturopathic medicine. I'd encourage you to check that out if you'd like more information. There's 7 or 8 schools just in the whole continent, including Canada, that are credentialed naturopathic schools, so they're a small minority compared to conventional medical schools. I graduated from the Canadian College of Naturopathic Medicine in Toronto, and I am a licensed ND in the state of Vermont, since Florida doesn't currently offer licensure. In addition to my 4-year medical school training, which included 2 sets of medical boards, I completed additional specialty training in the areas of oncology, tick-borne illness, weight loss, biotherapeutic drainage and what we call homotoxicology, mold illness, and adrenal fatigue and neurotransmitter imbalances across different centers and institutions in North America. I also worked as a specialty doctor in many of these areas for nearly 5 years for 2 of North America's leading supplement and research companies, including Neuroscience Inc., which is near Minneapolis, St. Paul, and Life Extension here in Florida in Fort Lauderdale. So a little bit about our practice. As mentioned, we do specialize in those areas, but we do also work with those who have more generalized health concerns. Underlying our care, regardless of what you're presenting with, is really a commitment to uncovering what's truly lying underneath your conditions, or what are the triggers and causes of why this is going on. And so we really seek to address your health concerns from that standpoint, and that will likely involve a combination of pursuing specialized testing, addressing your lifestyle and diet habits, nutritional supplement options, possible prescriptions, and possible other adjunctive therapies. We do collaborate and work with all kinds of other healthcare providers all the time, and these may include GPs, various kinds of specialty doctors like oncologists, infectious disease specialists, doctors, other Lyme literate doctors, OB/GYNs, acupuncturists, chiropractors, and more. So how are we unique? Well, I have a very experienced and uniquely specialized background to the practice in these areas that I do specialize in that really very, very few other doctors, whether conventionally or holistically trained, have in many ways. And I listed some here of those specialty trainings. So I did a fellowship through the ILADS Foundation in 2009, which is a foundation dedicated to helping those with tick-borne illnesses and also encouraging specialty doctors training in this area, with 3 doctors in New York who all specialize in tick-borne illness. I'm currently completing a certification training fellowship with Dr. Richie Shoemaker, which is in mold and biotoxin illness. He was really a pioneer in the field of encouraging a lot of research and doing a lot of work extensively with patients. I listed some of the specialty oncology training and experience here, so I did some observation and volunteer work in Medicore in Toronto, Canada, as well as observed in 2 notable cancer clinics in the U.S., the ISLS Clinic in the CTCA Center in Illinois. And then, as mentioned, I worked for the Life Extension Foundation for nearly 4 years and worked with several thousand individuals dealing with cancer of all different types in collaboration with the ISCA Cancer Alliance there. Did a lot of work in training with bioidentical hormone replacement therapy as part of being connected with the Life Extension Foundation, and have been working with Pamela McDougall, who studied with renowned Dr. William Kelly as well recently in learning that protocol for cancer treatment. Just some extra here, certifications and training. I won't go through all of that. You can see that here just to give you a little more background. And some of the additional things I've been up to recently in terms of book publication and starting to get into media to try and reach more and more people. That will be coming up in early 2015, and so I encourage you to stay posted. We'll be posting that on the site for the segments and airings that are coming up next year. In our practice, we really believe strongly that you need to be involved in your care, and thus you need to understand why, and, the why behind what's going on for you. This again is not just symptom management. So for some people, it may ask too much of you, but for those of you that really want to truly get well and recover and not just manage symptoms, for many of these lifestyle illnesses, this is really the way that is necessary, because in these cases, drugs are not going to really help the body regenerate and restore your nutritional reserves and deal with imbalances that are due to depletions and traumas that you've incurred. So it's important to understand that this is really lifestyle medicine. And traditional medicine care is really too often become a cookie cutter approach where your particular case is not given the time and consideration that's really needed to truly give you the care that's necessary. So we really try and take the time to make sure you understand your options, what and why we're considering in terms of your therapeutic choices, and what the pros and cons of all these are. And so in order to do this, we listen very carefully to your story, never judge you or devalue your experience, because you really do know your body better than anyone else. As a convenience and to ensure that you can access really professional level supplements, we partnered with HealthWave both in the US and Canada to enable you to have one-stop shopping from our office to your door for your supplement and health product needs. Many supplements in this country, in the US, they're not under federal regulation, so it's really up to the company to formulate them well, and HealthWave is partnered with Emerson Ecologics, which has a stringent quality control program, so only the supplements that have passed this are enabled to be purchased, so they're very high level quality. And so there's no requirement to use this service to work with us, but many clients find it very convenient and reassuring to know that you're getting high quality products delivered right to your door without the hassle and confusion of shopping in a supplement store, trying to find it on some other website where, of course, there may be a quality control issue. So what to expect in working with us? Well, as noted, many of the conditions we work with are really chronic conditions, and they've taken years to arisen in many cases. So in order to get well realistically, it's going to take a commitment of at least a few months to truly considerably change your health situation and to allow your body to start transforming and regenerating, because it takes time to heal, and we have to have the space in our life to enable that to happen. And that's because this is not just treating the symptoms, of course, but in approaching everything, the symptoms can certainly improve, sometimes within a matter of a few weeks and depending on the case. But all of this is getting at, again, that we're really improving and correcting the underlying balances. So we do ask of you to make potentially many changes in your life, and thus your motivation and willingness to do so is very important in facilitating the success in your recovery. So that's important for you to take to heart. So what you'll need to get started? Well, in order to work together in the beginning, we'll need to gather copies of your recent lab work, medical scans, imaging, and reports from the last 6 to 9 months for us to consider in initially reviewing your case. In your first visit, we will go through such materials as well as our intake forms to build a thorough picture of your case, what your options are in terms of moving forward, relevant testing to consider pursuing, initial steps you can start implementing right away, and other potential treatments through your other providers that might be worth considering and discussing. For example, if you're dealing with cancer, surgery with your surgical oncologist. So before we conclude, I want to leave you with a few final thoughts. In our practice, your care and your well-being are always the first priority. So if you're unsure of something, have questions about other treatments or considerations, we are always happy and willing to answer and engage your questions. Our goal is to help you successfully improve and resolve your health issues for the long term in such a way that leaves no stones unturned and all viable options explored and discussed. This is accomplished by always following the first tenet in naturopathic medicine, which is first, do no harm. And again, any questions, please email or call at your earliest convenience. We very much look forward to hearing from you. I want to leave you with a quote from Margaret Mead, the famed anthropologist here, about change. And this can apply in many ways in life, but in regard to your health and medicine, this also applies very much so. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Thank you again. Have a wonderful day.